Alright, so this is the fourth video, so this will be covering a neurological assessment and then the female and male genitalia. So starting out for a neurological assessment, usually whenever usually it just starts out with making observations about the patient. Like for instance, I work in an ER, and whenever I see the patient, I usually make observations first off, like looking at like their mood, kind of get an idea like of what they're if they're altered at all, like if they're alert and oriented and what they're alert and oriented to, and then of course I always ask questions just to further inquire, but usually just observe like, are they good mood, bad mood, just look and see like what their mentation is. Sorry. Then I'd move into the doing the assessment for the 12 cranial nerves. So first cranial nerve is this olfactory. I forgot to get something on me, but you just have them close their eyes and then just have them smell something, make sure they can identify what they're smelling.
Alcohol swabs.
Yeah, in the ER, I'd probably use alcohol swabs as the most easily readily available thing, and something that's not like gonna be real offensive. Then for the optic nerve, you just would do a Snellen chart, have them stand about 20 feet away, just check to see what their vision is. For the ocular motor, so I'll just use this is what I use this for my pen light. So I just would test for perla, so pupils are equal, they're both reactive to light. Then you usually have them focus on something just far away, and as you get closer, just make sure that their eyes are accommodating. So the next one is the trochlear nerve. So that one is just where you just have them follow your finger, just do up, down, and at the same time you can just have it go side to side. And so they follow. That's the abducens cranial nerve. The trigeminal nerve. So I'm gonna take a cotton ball and then just have them close their eyes and just tell me just say now whenever you feel it.
Now. 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 Now.
So next to the facial nerve. So just have them look at you. Just frown. Smile. Sorry. Just so puff your cheeks out. Right, next, and then just close your eyes like really tightly. Okay, so everything is good. Everything is bilateral. So next is the vestibulocochlear nerve. So this is one where I'm just gonna close one ear and then just whisper a word over on the same side as the open ear and just ask them to repeat it.
Peanut butter.
I'm gonna do it the other side.
Jelly.
Okay. And I won't have her stand up to do this, but like you would also just have them walk if possible, just to walk a very short distance and back, just to check their gait, to make sure that their gait is stable and even, and that there's not any instability towards it. Next is the glossopharyngeal nerve. So I don't have a tongue depressor on me, but this is where I just would open your mouth. So you'd have them say ah, and you'd be looking for the uvula to make sure that it's staying midline and rising up midline. And you also would use the tongue depressor to check for gag reflex. This also kind of goes with the vagus nerve. Also, you could check the vagus nerve in that voice sounds good and clear, not hoarse. The gag reflex is intact, which I'm definitely not gonna check you on that. Let's see. 11th one is the accessory muscle. So this is where you just would have them just rotate your head left and right. All right, and then you just would put resistance and just see if you can raise your shoulders on both sides. And then the 12th last cranial nerve is the hypoglossal nerve. So just stick your tongue out and just move it side to side. Okay. So those are the 12 cranial nerves. So then you should move on to like the sensory and coordination stuff. So for this, you just would be looking and observing like just the patient's musculature, make sure that they looks appropriate for age. Might note like if there's any like maybe atrophy or decreased musculature. You could test their balance by having them stand. Like I did in the first video, you just could have them stand and have them close their eyes for about 20 seconds, and then just to make sure that they have good balance. And then for coordination, I would just with your right hand, just touch your nose, and then touch my finger. Touch your nose, touch my finger, and then you could just repeat this for their left hand. All right. So for sensory, you could just do like something like use like a cotton ball, or just use something and just kind of just touch different parts of their body. Just make sure you do both sides. And you're just testing to see that they have equal sensation on both sides.
They're the same.
Make sure you don't have a stroke. So you could also do the same just with like vibrations. You also could do positional like sensoration. So like in this case, I would just relax your arm, like close your eyes. Like just you can tell that I'm like raising up your arm.
Yes.
All right, and then for fine touch, so just hold your arm out, like palm up, close your eyes. All right, I'm gonna put something in your hand, and can you just like kind of feel and know like what it is?
It's a key.
Yeah. It's my Darth Vader key. All right, and then last thing neurological was you would test all of the you just would test all the deep tendon reflexes. So it'd be like the patellar tendon is the most probably one that most people could name. Like the brachial one, but just you want to test those deep tendon reflexes to make sure that they're present. And then you'd test superficial reflexes. And then the last one you want to test is like test for it's like a Mengenille test. It's called has Kerning sign and Brzezinski sign. So I would say you don't have to do it just because you just don't lay flat to do it. But like for the Brzezinski sign is where if you're laying flat, you then try to touch your chin to your chest, and then if your abdomen and your legs kind of get raised up a little bit also, like that'd be considered a positive sign. And then a a Koenig positive one would be if you bend the leg, like if you're laying flat, have the hip and the knee bent, and then if you ask them to straighten it out and they experience pain while straightening it out, then that would be considered a positive sign. Okay, so that's all for a neurological exam. The only thing left is just the male and female genitalia. Obviously not gonna show any of that. So if you want to go ahead and do something else. Just don't be too loud. All right. So for a male genitalia exam, first thing you do is just inspect the base of the penis for any hair distribution, looking to see if there's any excoriation, if there's any redness or erythema. Also look to see if there's any infestation, heaven forbid, hopefully not. Then you would kind of moving outward a little bit, just like inspect the skin for any redness, any lesions, any ulceration, any lumps, any swelling. Check the foreskin, see if it's still intact, if they still have some, if they're uncircumcised. See like the location of it. Also see if it has any rash. You inspect the glands, noting if there's any redness, any lumps, any redness or ulceration on it. You then palpate using your thumb and 2 fingers. You would palpate the glands by squeezing a little bit for any discharge. So then moving on from the scrotum, then or on from the penis. Next would be the scrotum. So you just would inspect the scrotum, like look for any redness, any swelling, any lesions. Make sure the skin, like they check it's intact. They check the integrity. Note if there's any lesions, any lumps, any swelling. So then you would gently palpate the scrotal contents. Usually it's just the testes and the epididymis. Note the size of it, the shape. Note any tenderness, any nodules, like anything you might feel, if there's any hardness to it. Hardness and nodules also, I should say that, also note if you feel like that while you're palpating the glands or the shaft of the penis. Using a light, or similar to this, or if you can get like one, like just so transilluminate the scrotum, so you kind of shining like a light through it. So this is to help see any masses or if there's any swelling that's going on the inside. So moving on from there. So the inguinal, next would be kind of like right here in the inguinal area. So you just would first inspect, see if there's any inguinal hernias, if there's any femoral hernias. So just like look for any bulges, like kind of, if you ask them just to kind of like vagal down or kind of exert, like see if there's any bulges. You could then palpate in the inguinal areas for any hernias, kind of having them like turn from side to side. Then you just would do the same, palpate for femoral hernias. And then you would inspect and palpate for scrotal hernias. So now I'm actually going to go, I'll come back to the anus and the rectum areas, because those are shared for male and female. I'm going to move on to the female genitalia. So first, for external, you're going to inspect the mons pubis, noting any hair, like the distribution of the hair, and also, with men, you're going to be looking for any infestation. Gonna just look, inspect the labia minora and majora. You're just going to notice if there's any redness, any excoriation. Also, you're going to palpate, just note if there's any tenderness. You're going to palpate it's known as Bartholian glands. Like, there's kind of two little, usually only show up if the patient has a history of the glands being swollen, or if they're complaining about them being swollen at the time. If they have no history of it or don't have a problem, then you probably won't see any. And then just palpate the urethra for any discharge, noting any discharge, possibly might also have some urine discharge. So then moving on to the internal part, you just would inspect the vaginal opening, like noting the angle, noting the size of the opening. So then you would assess the musculature of the vagina, just with your fingers, wearing gloves and lube. Just want to make it as comfortable as possible for them. But you would just, with your fingers inserted, ask them to bear down, just so you can tell the musculature of it. So once you've done that, then you would use you do a speculum exam. So once you have the speculum in place, you would you check the cervical for the color of it, the size, the shape. Note if there's any tenderness or any discharge coming from it. If appropriate, collect any discharge or anything for a STD test, or any if a pap smear needs to be performed, you can collect a sample. Then you would do a bimanual exam. So with one hand and some fingers inserted, the other hand you would put on the abdomen, and you just would kind of apply pressure. And then so then you would remove the speculums, and then the last one you would do is a rectovaginal exam. So this would involve using fingers in both the rectum and the vagina, and just kind of applying pressure. So then moving on, so for the anus and the perianal areas, so this applies to both male and female. So you would first inspect just the opening, or just around the anus. Just inspect the color of it, see if there's any redness, maybe there could be maybe they're having some breakdown, if they're having diarrhea. Notice if there's any lumps, any nodules, any swelling, any rashes. And then you would inspect the forgive me for, I'm sure I'm going to pronounce this wrong, but the sacrocoxal, inspect that area if it is applicable. I had never seen that before, but I probably will never get that, probably won't be able to get that image out of my head for a little while. But you guys would inspect that area for any swelling, any tenderness, any redness, any nodules, and any masses. You'd also inspect the anus just to see if there's any rectal prolapse, just to see if there's any like protrusion out from the anus. If there is, just note like the size, any coloration to it. And then you should palpate around the anus, just noting any the sphincter or the anal sphincter tone, and then note if there's any hardness or any nodules with it. And then the last section is just for a rectal exam. So you just would palpate the rectal mucosa, just noting the color, if there's any hardness, any tender areas. Might all be tender. If there's any, you'd also palpate the peritoneal cavity, noting any hardness, any nodules, any tenderness. The one thing that differentiates between male and female is, in just a male exam, you would palpate the prostate exam or the prostate gland, noting like the size of it, the shape, and just if there's any nodules or if it's swollen. And then the last thing you would do for both male and female is just inspect their feces or their stool, just noting if there's any blood in it, like is it dark, is it kind of tarry looking. And then you can also do a occult stool exam just to get a positive or negative test on their stool for if it contains blood. I do probably at least about 2 or 3 of those almost every day. That is this video.